with the Dutch test, it's quite clear. It's quite nice because you can really see that comparison between the estrogen and the progesterone. It allows me to, tailor the treatment a little bit better too. Yeah, in terms of how
Yes.
much I would
And does
use.
testosterone show up on that panel as well?
It does. Yeah, it does. Um, Sometimes testosterone will be quite normal, even when you're in perimenopause or menopause, and sometimes it could be completely low.
Hello, SoulNet friends.
Welcome, SoulNet listeners.
Hello, SoulNet friends.
Welcome back, SoulNet friends. We are very excited today to be welcoming Dr. Ana Lopez to our show. And Dr. Ana Lopez is a naturopathic doctor with a general family practice here in Vancouver, BC. She has a Bachelor of Science in Cell Biology and Genetics from UBC, and she received her naturopathic training from the Boucher Institute of Naturopathic Medicine. Dr. Lopez has been serving her community since 2007. She believes in empowering her patients through education and choice. Dr. Ana Lopez, welcome to the pod.
Thank you.
Welcome.
Thank you for that nice introduction. Thank you so much.
We're so happy to have you. You're a special guest on our Menopause series. And before we get started and dive in with you on an important topic, I just wanted to let the listeners know how we met you or how I came to know you.
Mm-hmm.
So I was referred to you by a friend. I was experiencing menopausal symptoms, specifically hot flashes, interrupted sleep, higher anxiety, and mood swings. I was looking for help. I just wanted help to understand what was going on in my body and if I could help myself through these symptoms. I was referred to Dr. Lopez, and she kindly accepted our invitation to be on the podcast today, specifically to talk about testing, hormonal health testing. I was a bit of a unique case in that I have no uterus. I had my uterus removed about 10 years ago. I had a very large fibroid growing inside my uterus. And so I unfortunately didn't have an option but to remove it. So I have not been having a cycle since then, right? For many years. So it was hard for me to know where I was on the perimenopausal journey. And so Dr. Lopez spent some time asking me a bunch of questions about my health history and felt testing would give us a better idea and a better profile of where I was in my menopausal journey from a hormonal standpoint. So let's get right into it, Dr. Lopez, because you recommended that I get the Dutch test.
That's right.
The Dutch test seems to be highly recommended by naturopaths in Canada and the US. And I was wondering if you could share with listeners what the Dutch test is, what kind of information a woman gets from the Dutch test, and how it's helpful for a naturopath to then provide a care plan.
All right. Okay, so the Dutch test is a urine test that is collected over a period of 2 days. And it tells us about the hormone levels. We want to know about not only the levels of your estrogen, but also the metabolites. But it does other things as well. It will test for progesterone, for testosterone, DHEA, and cortisol as well. So there's different panels, and some panels will only do sex hormones. Others will only do adrenal hormones. And then there's one, this is the one that I recommend, is the complete Dutch test, which includes the adrenal hormones and the sex hormones. And the last part of the complete that I would do really like is that it tests for organic acids, which are basically markers in your urine that tell you about different vitamin deficiencies, the state of, your gut health. So it gives you some idea of what that's, what's going on with that too. Because some of those components are important for hormones, like the B6, B12 are part of the whole hormone biochemistry. So they're really important to know if, those were low, they would be affecting you. Yeah.
And those are, if we are going through a lot of stress in our midlife too, those are really important ones.
That's
too,
right.
from my
Yeah,
understanding.
really important. The adrenals, adrenal health plays a big role in how symptomatic you are during perimenopause and menopause. So if everything is really depleted, then you're actually going to have worse symptoms. So it's nice to have a look at sort of everything
May I ask, is there a test for the inflammation markers?
Yes, there's only one,
Okay.
and it's for neural inflammation. So it doesn't
Ah,
test the overall inflammation in the body. You can do more of a blood test for that.
okay.
It doesn't do thyroid. We can do that through the blood,
Okay.
a thyroid panel. Those are the sex hormones, adrenal hormones, and then the organic acids. And they're part of the Dutch Complete, which is the one that I tend to recommend, because if you're going to, take that test, it's not a cheap test. It's about $460 for the Complete. And if you do the adrenal or the sex hormones, it's 300. So, you're spending a little bit more, but you're getting way more information.
I see.
So what I find interesting is that from your family doctor, you can request a blood test, right, for your thyroid and for maybe other things. But through our British Columbia healthcare plan, right, at this point anyways, I just found it very hard to find out all this information, hence why I invested in doing this, because I felt like I really wanted to get that kind of overview at this particular stage and have the right information and a complete profile. Because really, if you're just going for a few tests from the doctor, it doesn't really give you the complete profile.
That's right. And sometimes especially if you're in menopause, the doctors don't really want to test you because they go, well, haven't had a period. What's the point? It's, sort of things are low. So, why bother? Right. But we like to see, with the Dutch test is quite detailed. So we can see there's a menopausal range for women on the Dutch test. And then there's, more a fertile range as well. But if you're in menopause and you're below the menopausal range, then it means that you really have like no hormones in your body. So, so you're very, very low. Yeah.
Wow.
For women who aren't able to test through the Dutch tests, they can get any kind of testing through the GP. I think it's helpful anyways. At the very least, they can get an FSH test, which tells you, if it's quite high, then you're really in menopause. If it's in the hundreds, then you're definitely already there. And so there's no hope that your period is going to come back probably. So
Right.
And if you don't have a uterus, like you, Megan,
Yeah.
sometimes, having just the FSH is helpful to know, okay, if it's 100, then you've already gotten to the point where you are in menopause already. Yeah.
Right. I find with friends and women that we talk to that it's the perimenopausal phase
it's brutal.
Like there's so many people like that are like it's long, it's it's brutal, right? It's a roller coaster of
it is. It changes from day to day.
It changes. So the FSH will tell you when you're in menopause, but it doesn't necessarily tell you the 5+ years that you're in peri. Is that right?
That's right, because the FSH can change quite a bit from month to month because your hormones are changing from month to month, from day to day.
Exactly.
So your FSH could be at a fairly decent level one month, and the next month, like your FSH could go from like 30 to 50 the next month, and maybe you've skipped a cycle, and then then it's going to be higher. So so it's you can't really tell too much from the FSH when it's tested during perimenopause.
Right.
But definitely when you haven't had a cycle for a while, then it gives you a better idea that if you are truly now in menopause or not. The perimenopause is it's a period of time that, could be 10 years before you finally end your periods. So you could start having changes quite early on. And at first they're very subtle.
Yeah.
They can manifest in maybe just a slight reduction in the length of your cycle. So maybe you went from 28 days to 26 days.
I noticed that.
So that's usually
28 to 23 for me for about 3 years.
Yeah. And that typically during perimenopause, usually estrogen production is really good, but it's the progesterone because the ovulation is not that effective sometimes. So then the progesterone making part of the cycle isn't that high. And so you start having this decline in progesterone.
That's right.
And that can lead to the shorter cycles. You can start to have trouble sleeping. So progesterone deficiency will really affect sleep, and it'll affect your memory.
Oh, yeah.
So suddenly you're really forgetful, and you're mid-sentence like, oh, I know this, and you just can't get it out. So it starts, sometimes very gradually. And
Yes.
and then you start seeing the mood swings As you become more progesterone deficient or estrogen dominant, then sometimes you start having a lot of PMS, all these types of symptoms. So it can be pretty crazy.
Yes.
I know it can be, but let me just ask about the Dutch test then. That urine test, is it the only option for women to find out if their progesterone is low? How do they help themselves if they don't have $460 to spend?
Yeah, I mean, you can still request a progesterone test from the doctor, but it has to be tested on a specific day. So it's not helpful if it's tested at any time in the cycle. It has to be about a week before you're expecting your period.
And what if you're not getting?
And if you're not getting a period, then it's not so helpful. But then it's sort of random, right? You don't know, but you could test it. And obviously if it's quite low anyways, I would expect it to be low if you're not getting a period. I sometimes just go with symptoms, because it's quite clear to me what the person is going through, what the problem is. When I hear, I can't sleep and my cycle is shorter. I've got memory issues. Like I can't remember things that I know very well. And I just can't remember at the moment when I'm asked about them. So then, those types of things will let me to think that, progesterones, depending on, your age and how bad the symptoms are, I use different, I'll use herbs or I'll use actual hormones or cream, progesterone cream, oral progesterone. Yeah, it depends. And with the Dutch test, it's quite clear. It's quite nice because you can really see that comparison between the estrogen and the progesterone.
Yeah, amazing.
It allows me to tailor the treatment a little bit better too. Yeah, in terms of how much I would use.
And does testosterone show up on that panel as well?
Yes.
It does. Yeah, it does. Sometimes testosterone will be quite normal, even when you're in perimenopause or menopause. And sometimes it could be completely low.
What would be some of the symptoms of really low testosterone?
Low testosterone would be a lack of sex drive. Sometimes it does affect your sleep.
Yeah.
But also like muscle, say you're going to the gym all the time, but your muscle just won't build. That could be a testosterone problem.
I heard also lack of confidence. Is that something you've noticed, Anna?
Maybe. I guess testosterone for men, I think it does give them, a sense of, confidence. So I would imagine maybe for women it's the same, although it's, much smaller amount. But yeah.
It could be tied to the low sex drive too, Eileen.
Perhaps.
Like when you don't feel sexy, you don't, and if you identify with feeling sexy
or having a desire,
and being sexy, and then you don't, or having the desire and then you don't, it's almost like you're having an out of body experience. Like you're like, who am I?
Yeah, that's
exactly.
true.
Yeah.
Testosterone, we, naturopaths in BC, we have a lot of prescription rights. So we can do a lot of hormones, estrogen, progesterone. We can't do all the hormones that are considered anabolic. So testosterone, DHEA, we can't prescribe. And so sometimes I will work with the GP and request if they think, it's appropriate for the person to have maybe DHEA or testosterone, and I'll give like an idea of, I'll give a dosage. And but it's up to the doctor, of course, to prescribe. I do try to see if we can get that sort of thing, through the GP because I'm unable to prescribe it. But I do think that it can make a big difference in how the woman feels. When they take those things.
I've had that too. So I'm in health and fitness as a coach, and I've had women that have gone through that low testosterone, and they've had a really hard time getting it, even through their GPs. So I feel like it just shows that we have a lot of work to do still on understanding these prescriptives for both men's and women's health.
Yeah,
right?
and it's DHEA you can get in the US. It's a supplement that you can buy just on the shelf, but the testosterone is a prescription item for the US as well. So you do need some doctor to prescribe it.
And do we have any understanding of thinking about hormones and these all being kind of essential hormones? Like testosterone is really important for women as well. So do we understand, like what is part of this, the bigger system of wellness of why they're not acknowledging these needs for women? Do you have any kind of insight to offer?
I just think the typical GP doesn't get as much training on hormones unless it's a special interest of theirs. So I'd say women doctors tend to obviously have more of an interest in that kind of thing.
Yeah.
And some doctors, I have come across some medical doctors that don't really know much about it. So they do recommend to patients that they go and see a naturopath for,
Amazing.
Oh,
So I think there's a lot more openness about, collaborating than there used to be.
Amazing.
Yeah, because I do see a lot of prescribers, a lot of GPs prescribing, bioidentical, progesterone, which is called prometrium, and also the patches. They're all bioidentical generally, Estradot, Climara.
That's very encouraging.
There's kind of a move away from, doing like the synthetic hormones like progestin or recommending like the birth control pill and that kind of thing.
right,
So
right.
yeah, so I think there's definitely more, I think, awareness now about menopause, and not that it's just, oh, your cycle ended and you have hot flashes. There's all this other awareness of how it affects your mental health and your functioning. And so it isn't just, oh, it's just for, hormones are just for hot flashes. I think they can improve so many things, including your, bone density, right?
Yeah.
Cardiovascular disease and things like that.
Cardiovascular health. Yeah.
If you were to prescribe certain hormones for a client,
Mhm.
how is the process as far as figuring out the right dosing and the kind of dance between them? How do you
Right.
kind of, is it trial and error? Is it like,
It's a bit trial and error. I mean, my approach is to always kind of start on the lower end of things and then up it,
Hmm.
if it's needed. Because I think if you go too high, you can make that woman feel a lot worse.
yeah.
It may
Hmm.
be temporary, but yeah, you might go through a period where, oh my God, you have no hormones and suddenly you've got tons, and then my goodness, your boobs are going to explode, or like you're so sore or something, or suddenly sometimes you have had the sleeplessness can get worse if you give too much. So I always start kind of slow, and then we ramp things up if necessary. The test gives me an idea of where I need to start from. So if things are really deficient, I would maybe want to start with a gel that's a little bit higher in dosing, but I still would be, a little bit careful to not exacerbate symptoms. And it's interesting because two women can have the same results on a Dutch test. And what works for one in the end, like the actual optimal dose, is different
Yeah.
because it depends on, absorption through your skin,
Yeah.
your lifestyle, obviously your genetics of, to do with detoxification.
Mhm.
And so, yeah, how quickly you clear your hormones. So somebody may need, even though they're starting from the same place, one might need, a 50 microgram patch and the other one needs 75 to feel good. Or like with the
Ah.
bias cream, same thing. You could, one might have like the lowest dose and that's perfect, but somebody else with the same numbers might need actually 2 times more than the other one. So yeah, so there's a bit of trial and error with that,
Right.
with prescribing.
I noticed that because I have a question about that is that I noticed that when
Mhm.
I started some bioidentical estrogen and progesterone, there was about
Mhm.
3 weeks in the very beginning
Mhm.
where my breasts were super
Mhm.
tender and it felt a little bit roller
Mhm.
coasty. And then it settled down, and then my sleep started improving. And then it just felt like the roller coaster was starting to regulate a little bit. Progesterone stayed the same at
Yeah, yeah, it's 100
100, yeah,
usually.
that
That's the
stayed the
standard
same the whole
dose. Yeah,
time, but with estrogen, I went from
yeah.
zero point 0.5 to 1, and then I noticed my
Mhm.
system really regulated from there, and
Mhm.
I would say in
Yeah.
the last few weeks, it's like it's now found kinda like its pace, and it took about 5 to 6 months to find that pace,
Yeah.
and so to your point, it's just this continual monitoring and seeing what
Mhm.
there might be a bit of a bumpy road for the first few months like what
Yes.
I had.
At the beginning,
Yeah,
yeah,
and I
yeah. At the beginning, there can be.
and I thought I was getting close to menopause, and then boom,
Mhm.
I had a spotty cycle, and so it reset the clock. So my question is, I'm
Mhm.
wondering if you find that Dutch tests are more helpful for women in peri or to wait till menopause, just because of the fluctuations during peri, and what your feedback to our listeners would be or recommendations.
Yeah, I find it helpful in perimenopause. Sometimes in perimenopause, you might be at the point where your estrogen is already starting to decline, or you may be at the phase where it's really high. And so then, yeah, sometimes in perimenopause, it's not so clear whether I
Right.
may need to give supplemental estrogen or not. And so then I would probably use it in perimenopause. I would say in menopause, a lot of women want to have a baseline.
Mm.
But sometimes what I do, let's say if you come to me and you haven't had a period in 2 years and you're not feeling that great, and maybe in those 2 years you had some hot flashes and things were manageable, and that's because even though you're not having a period, you're still producing a level of estrogen that is enough to make things a bit manageable, but you're not having a period. As time goes on, though, that estrogen kind of dwindles, and
Right.
so then by say 2 years after your last period, then that's when you may be hitting really low levels of estrogen, or maybe a bit later than that, but then you start having, sort of all these hot flashes and things. And so then sometimes what I do is I actually I give hormones, and I wait until we're sort of at a more of an optimal place with the dosing. And then I do the Dutch test, because then I can see where you're sitting in that, whether your levels are, registering on the Dutch test, at least. And, usually if they're feeling better, they would be.
Right.
But then I can see, okay, it's a little bit too high what we're using, or, it's not enough. We could go a little bit higher. So for me, it kind of helps me figure out if what we're doing is sort of more optimal, the optimal dosing. If women want it, sometimes they have benefits that will cover. And so they, then we get a baseline, but, not everybody has benefits that will cover the Dutch testing. So, I think it's more useful if I see it later, if I see it once we've started some hormone therapy.
Okay.
It feels like there's so much beautiful information coming out now that we are supporting women through hormone replacement therapy. And as someone who hasn't taken anything yet, I do have a naturopath as well. And I've taken, supporting herbs to go along with that. But I find it kind of confusing, because I feel like all this great information that's coming out is telling me to take hormones. And I don't know that I need them. And I'm willing to take them. I'm not against them. I want to feel good through this time of my life, but I also don't want to take something that I maybe don't need. And if I'm actually one of the people that maybe can move through this through some lifestyle and maybe some gentle supplementation, my questions are, do I need the hormones now? And if I were to take the hormones, would I be setting myself up for a cliff fall off in like 10, 15 years? Or am I going to be having to take these hormones for life? Or am I going to be okay if I just kind of ride it out the natural way, so to speak?
Oh, yeah. You're definitely going to be okay if you write it out the natural way, for sure.
Okay, good.
Yeah, for sure. But yeah, it's definitely a personal choice whether to, go on hormones or not. And some people's menopausal journey is a lot easier than others. And so then, some women just don't seem to be able to function all that well. And even though they're taking herbs and all that, it's just the symptoms are just so bad. So then, the hormones are the option. And so, and then what happens is, I think the hormones are really helpful in the first few years after menopause, in that because there's an erratic production of estrogen. So, you're doing this, right, with your estrogen, and that creates a lot of symptoms.
Yeah, the roller coaster, right? The peaks and valleys.
Yes.
That's right. There's peaks and valleys. And then later on, you get to the point where your estrogen is just low and it's not doing this thing. And so then if you go on hormones and sort of right out to the, to the point where, okay, yeah, my estrogen is sort of more flattened out, right? Then if you choose to go off hormones at that point, then you won't have such a rocky, like such a rocky transition compared to, say if you were trying to use the hormones to help you with your, hot flashes, but you kind of try to go off too early, almost like say within a year of, or maybe a couple of years after stopping your periods, then you may still be in that where there's still a lot of fluctuation. And so then it may be too early, but if you wait a little bit longer, then you will kind of go past that. And so it'll be easier for you to come off. I think you still have to wean off anyways. You don't just stop in cold turkey, just because you have to allow the body to, get used to lesser amounts. But I don't think it'll be as rough as, the beginning. Yeah.
Amazing. Thank you so much for clarifying that. I've actually been asking in a lot of different circles, and I haven't gotten a good answer. And that's been, a really hard part when we're trying to inform our own decision, is like, well, is it a short-term payoff or short-term gain, long-term? I think you know what I mean.
Right. Yeah. So for some women, hormones are not an option, right? If they have family histories of breast cancer or something like that, you it's not that the hormone is going to cause the cancer. It's more like you already have this predisposition to having maybe cancer happen in your breast. If it does happen, then usually they're estrogen driven. And so then if you're taking estrogen, it's going to make it grow quicker. So it's not, I don't believe that, the estrogen is causing cancer. It's more like it will make it grow if it happens, right? So
like it ripens the environment for it.
Exactly.
Yeah. Okay.
If the cancer happens, then it's like you're adding the fertilizer to make it grow more, right?
Yeah. Yeah. Well, that's where I think the information, I mean, having a naturopath like you, Dr. Lopez, right? Working hopefully in collaboration with your GP, your general practitioner, your physician. For women, I think it's just having a little bit of like a team, right? Because it all matters.
That's right.
Your health history matters. Your family history matters.
Lifestyle.
What's going on in your body. Lifestyle matters. And so having these conversations with professionals, I think is really what we're as a group here trying to advocate for. Yeah. And we are joining in on this conversation, I think for that purpose, right? To let people know that all of these things matter to your health, to how you feel and how you're going to feel, right? And how to kind of stay well through this transitional time. So having professionals to work with you and ask these questions and review all the information is so critical.
Yeah, it's really important. I think it really empowers you to know, okay, this is what's happening and this is what I can do about it, and I think that's, it makes a big difference, right? Otherwise you're kind of sort of going around kind of blinded
walking
and
in the
not
dark.
knowing, okay, why am I having, you're in the dark, right?
Totally.
And it's like, oh my God, I'm going crazy, and sometimes people go, I think I need an antidepressant, and it's not that, it's, you need help with your hormones and, that will help your mental health.
Yeah. So, from my understanding, that's historically what is, given for women is the antidepressants. Oh, you're just depressed. And it's a bigger picture than that that's happening, right?
That's right. Yeah. Yeah. And the antidepressant maybe would help, but I don't think it's the right thing. It's not the right thing. I mean, maybe sometimes it is, but sometimes it's just, you're just going through hormonal changes and that's what's messing up with your neurotransmitters.
And all my work with, clients around mental health too, like there are often side effects to the antidepressants.
That's
and a lot
right.
of that is weight gain
right.
that a lot of women are experiencing already with the hormonal fluctuations. So then affects the confidence and all these things. And so it's like,
that's right.
You have to really weigh what is the right, individually, as you said, I loved your point about just the uniqueness of each individual, because we really talk a lot about that here on our little pod too, is that we are all so different and we all kind of got to feel into, what's going to work for us and build our teams.
Yeah. Some people need, certain things and others don't need them at all, So we have to take into account people's biochemistries and And actually one thing that I wanted to mention was that the Dutch test, it looks at estrogen metabolites.
Oh.
And that's helpful because there's some metabolites that are considered a little bit more sort of DNA damaging. And so if you have those, the nice thing is that you actually can modulate them through diet, like supplements and dietary choices.
Wow.
And so then, if you do happen to have this sort of genetic way in which you break down your estrogens, you actually can shift it.
Amazing.
So it's, So if you know that, right at the beginning, like say, if you're considering taking estrogen and progesterone, knowing that you have this, then you have to have an additional thing maybe that you need to take, but it doesn't preclude that you shouldn't have the estrogen. Yeah. So it's helpful.
I feel like back in the day, when we didn't have this information and we didn't have this, the ability to connect with people like you, Dr. Lopez, and really talk it out. I feel like it was almost like menopause was just kind of a box that like all women went into.
Cookie cutter.
Like it was just like, this is going to happen. And, here you go. And very cookie cutter. And what we're really coming to realize, to Dana's point and all of your points, is that we are so unique. Every single one of us, with our history, with our ancestral lineage, like we are all very unique. And to really get an understanding, a really good understanding. And that's why I wanted to bring you on today to talk about the Dutch test in particular, but just testing in general, just bringing to light, really getting an understanding of your health
Blueprint almost.
like profile is really critical. Yes, it's like a
Yeah.
blueprint. You know, what works for one doesn't always work for another. So
Yeah.
don't feel lonely
That's
out
right.
there, listeners, like we all do. But we all feel
Totally.
so alone and sometimes in our unique symptoms. We are all going through our unique experience.
Yeah.
But we're not alone
That's right.
in the fact that we're going through it, right?
We all go through it. Yep.
Oh my goodness. We all go through it.
Yeah.
I just want to go back to the Dutch test again, if you don't mind.
Of course.
I was really just kind of curious about like your patient base, because that's kind of all we can really ask about. When you have a woman that takes the test and you obviously, make suggestions, how many people are like making it work with, supplements, and how many are actually needing the HRT? Like, is it sometimes a combination of the two, or what are you kind of seeing out there?
Yeah, sometimes it's a combination of the two. It depends on, the woman's age and what they'd like to do, how bad the symptoms are. But sometimes, let's say we'll do the Dutch test on somebody who's in, mid 30s. And so then for that woman, it will likely just be supplements and dietary changes, right? So we're trying to just, maybe they have a lot of estrogens. We want to clear some of that out. And then later on, say if you take it when you're in your 40s and we're noticing, okay, progesterone is going down, then I may just do a supplement, like a herbal supplement that promotes progesterone, like chaste tree, for a while. And then, if that seems to be working, then we do that. I mean, obviously we look at also the stress and things that could be done about that, maybe support adrenal health.
Yeah.
I do that through supplements, just eating better, exercise, that all those good things that help us get through stressful times. Yeah, and then say that woman, maybe they're say 43 when we do that, but maybe by 47 or 48 things have shifted, and then I might then introduce something like progesterone if they're really struggling with sleep or something. And so, it just depends what is needed, depending on the age and what I see on the tests and the symptoms. It could be a variety, a mix. Yeah, it's often a mix.
I want to just say, if I may, are you optimistic about the way, like the fact that we are all having conversations? Women are starting to really feel more empowered with knowledge and with the opportunities that are available for us. Are you feeling optimistic about where this is headed? Maybe getting more advocacy, more coverage for women's health in this area?
Well, I think so. I think there's so much more knowledge nowadays, about, the transition into menopause that, I mean, there's lots of people on the internet talking about it, like, it's there now. I don't think women these days, they go to the doctor and it's not like before where they just, okay, what the doctor says that goes and that's it, Now everybody's sort of searching for more answers.
Yeah.
And I think people also are spreading the word, right? Like when people are having successful outcomes and they'll tell their friends and it's like, people are more informed. Yeah. And I think it's good. And I don't think we need to suffer like our grandmothers did.
That's right.
So, I'm very hopeful. Yeah.
And so what I'm hearing from you too is indicative of what we're also learning, that, this age of perimenopause can start at very different stages for a lot of women. So someone coming into you actually in their 30s would actually be could be a great time to be starting on this stuff, because you can start to support them even before they're actually in the throngs of perimenopause. Is that correct? Yeah.
That's right. Yeah. So that way they won't get so depleted, by the time they get to be in their mid 40s.
Yeah.
It's, I guess if you don't have a lot of hormonal symptoms, you don't really need to take the Dutch test. But if say your mother had menopause early, and, then I would, with that person, I might be doing a little bit more looking into the hormonal status, testing FSH, ovarian reserves, maybe, just so that we can find ways maybe to prolong if there's a family history of ending like premature ovarian failure or something like that. Yeah. What can we do to try to preserve that? And that's a lot of that is supplementation though.
And that would be what we maybe call like preventative care too. Like, is that kind of that's the mindset too? Is that like, so we're trying to stay ahead of what might be coming, right?
That's right.
Yeah. Amazing.
Yeah. Trying to. So
Yeah.
yeah, so I think it's not necessarily your fate to also, end early. Maybe,
Mm-hmm.
if there's a strong family history where, all the females ended their periods early, you may not really make it to 50 with a period, but, hopefully we'll be able to get you into, at least to mid 40s to,
Mm,
have your menopause at that time rather than in your late 30s. So, and for a lot
mhm,
of women also just having babies a little bit later,
mhm.
that would
Mm.
be really important to work on, because
Yeah.
if there's that history, then you don't have a big window of time where, for babies. So yeah.
Yeah.
So yeah, so it's about preventing, and yeah, starting early is always good, I'd say. Yeah.
Mhm.
But often, when we're in our early 30s, sometimes we feel good, so we're not even thinking menopause.
So
I know.
So
is there something that you could offer maybe our younger listeners or
Yeah.
any age? Like what would be a warning sign
mhm.
where you might start to say, okay, it's time for me to have a conversation with my GP, or it's time for me to sit down with a naturopath and have a more in-depth conversation about what's happening? Is there anything like symptom-wise that you could say this is a like, hey, it's time to reach out?
I would say, if you have a history of like really heavy bleeding, that could be something about your estrogen levels, like high, either your
Mm,
progesterone compared to your estrogen, they're
mhm,
not, they're out of balance. Yeah, hot flashes. Some women are having night sweats even in their 30s sometimes. So that would be another thing that would prompt me to say, maybe you should have that looked at, and let's kind of figure out why that's happening to you. Yeah, I think those two things would be, I see those in women around that age, and I think
Mm.
that it's worth exploring why it might be happening. Yeah.
great. Thank you for that. That's great. Yeah,
Mhm.
amazing.
Such good information. So thank you, Dr. Lopez. We're going to wrap it up with that. We just are so grateful for your information, for your time today. And I wanted to offer your clinic.
Mhm.
If anyone that's listening is wanting to reach out to you and get in
Mhm.
touch,
Mhm.
your email is Dr. period ANALOPEZ at
Mhm.
gmail.com,
Yeah, that's
right?
it.
Dr. period Ana Lopez, 1N at gmail.com. And your clinic is Noble Naturopathic Clinic.
Mhm.
And there's a couple of locations.
That's right.
And so people can find you at www.noblenaturopathic.com.
You got it. Thank you.
Perfect. So, listeners, if you're wanting to get some more information or possibly consider the Dutch test, or just, possibly interested in supplementation, some herbs and supplements to help support you, Dr. Lopez and her
Mhm.
colleagues
Yes.
at Noble Naturopathic can assist you. So grateful for your time today. Thank you for helping us understand it. You've helped me personally, with my low levels of progesterone, and just helping me to feel better in my body with supplementation. And it's not a lot.
Thank you, Anna.
Thank you so much for having me.
Thank you.
Thank
Yeah,
you
really
all.
appreciate you. So we'll wrap that up, SoulNet, and wishing y'all well. And it's empowerment, right? We're empowering, and that's one of the things you do so well, Dr. Lopez, is empower women to make choices and to get educated. And we're just so happy to be part of that conversation.
Oh, thank you. Thank you so much.
Please note that the information we share in our episodes is not medical advice. If there's anything that piques your interest and curiosity, please follow up with your healthcare provider. Thanks for listening.